Good morning, afternoon, evening, whenever it is you're available to watch this. My name is Eric Emery. I'm an F&P student at the University of St. Francis, and we'll be talking about the use of devil's claw as an herbal medication when treating OA or osteoarthritis and low back pain. So to bring this into perspective a little bit, low back pain is the second most common reason for visits to the family practice office, and it's only second to upper respiratory infections. So low back pain is very prevalent within our offices, and also the CDC is projecting by the year of 2030, 67 million Americans ages 18 years or older will be suffering from some arthritic condition. So this might become ineffective in the years to come, especially for those patients that prefer the use of complementary or alternative medicine. So the active ingredient in this medication is a major chemical component, and it's responsible for most of the anti-inflammatory properties, and it's referred to as harpegicide. So you can buy this medication as isolated ingredients or also as a whole extract, as I have here. So harpegicide is found primarily in the root of the plant and works kind of like an NSAID does. It inhibits cyclooxygenase 2, or the COX-2 as you might be familiar with it. It also inhibits the expression of lipopolysaccharide-induced nitric oxide. In its study in 2002, 250 participants were placed on this remedy using 50 milligrams of this of devil's claw over an 8-week period for osteoarthritis of the hip and knee. After that 8-week period, 57% of the individuals within the study reported a decreased pain response or a decreased level of pain of the hip, and 36% reported a decreased pain in the knee. So it's pretty clinically significant in that study. Aside from its anti-inflammatory properties, it also has some cardiovascular and central nervous system components. Those include decreased blood pressure, decreased heart rate, some antiarrhythmic properties, and anticonvulsant properties. However, that hasn't been really clinically shown, so it's not indicated to use this medication for those conditions. The Natural Medicines Comprehensive Database has a rating scale, or how to rate the effectiveness of this medication, and they've rated this medication as possibly effective for the treatment of back pain and osteoarthritis. So briefly, there are really no serious drug interactions. However, you should keep in mind the comorbidities of your patient and the mechanism of action of the drug. Patients on anticoagulants, just like an NSAID does, this medication is going to increase the risk of bleeding, so be careful with those kinds of patients. It's contraindicated because of that in patients with gastric ulcers, duodenal ulcers, or any form of active bleeding. So keep that in mind. For your diabetic patients, this drug may contribute to some low blood sugars. So make sure you're educating those patients to keep some hard candy, glucose tablets, etc. on hand, and make sure they're aware of the signs and symptoms of hypoglycemia. You shouldn't give this patient, as previously discussed, because of the drug's antiarrhythmic properties. You shouldn't give this drug to a patient that's on an antiarrhythmic drug like DIG because of decreased heart rate. Also, you should avoid the use of this medication in patients with gallstones, and make sure you're educating your patients that they may experience some mild GI upset, nausea, vomiting, diarrhea, headache, or tinnitus are the most common adverse effects. So that's a brief overview. I'm just going to open the floor to questions. So a question from Lindsay Mormon, who is also an F&P student, was, is this a medication appropriate to prescribe to patients of childbearing age or patients who are known to be pregnant? And the answer to that is no. This medication is contraindicated in pregnancy. And as far as patients of childbearing age, you want to be sure that they are using appropriate birth control and are aware of the risk of utilizing a medication like this during pregnancy. She also asked about children or older adults, and generally, just as a general practice with any herbal remedy, you want to be careful with infants, children, older adults, because there's a lack of clinical evidence. As far as price is concerned, Andrea Dedamore wanted to know about if it's expensive. It's pretty cheap, $15 for a month for this bottle, and it comes in separate forms, so it's going to vary. And then how do you choose a certain preparation? You just want to be aware of the clinical research and make sure you're choosing a preparation that's appropriate for your patient. So basically, individualized care. Thank you.